When it comes to electrode placement, electrodes should be replaced daily to prevent skin breakdown and to allow optimal conduction. Limb electrodes are placed on the torso to reduce muscle artifact during limb movement. Telemetry functions with 5 leads. The white lead or the right arm lead is placed below the clavicle close to the right shoulder. The black or left arm lead is placed below the clavicle close to the left shoulder. The red or left leg lead is placed below the rib cage on the left upper quadrant of the abdomen. The green or right leg lead is placed below the rib cage on the right upper quadrant of the abdomen. And then your brown lead or your V1 lead is placed below the rib cage in between your right leg lead and the xiphoid process. An acronym that you can use to easily remember the lead placement is white to the right, clouds over grass, chocolate is close to the heart, and smoke over fire. If the patient has a permanent pacemaker, check that the monitor settings are set to paced. If it is not picking up the pacing spikes, then move the RA electrode down to the 5th intercostal space and the left leg electrode is moved up to the 5th intercostal space. Any misplaced leads may lead to misdiagnosis. First, you'll put new batteries in your telepack and then identify your telepack number. And in this case, we're using telepack number 3. Okay, on the screen, you're going to identify that this is Tele 3 Fort Saskatchewan. So you're going to choose within this box, you're going to click on Manage Patient. Now what you're going to do is you're going to put in the name of your patient, and in this case, we're going to say Minnie Mouse, and then you have to fill in your MRN number as well, or it won't let you apply it because it's all got the stars. So just for an example, so then you would go apply. Right here in this corner, you would press apply. Once that's applied, you're going to go to this triple dot here where your equipment is. You're going to click on the triple dot. You're going to identify your telepack on this side. So in our case, we're telepack 3, highlighted in blue. Click the over arrow to here, and then click OK. Now your screen is going to start picking up your patient. Okay, now that we're recording the patient's rate and rhythm, we're going to want to check all of our settings. So you're going to go to Manage Patient. Go to the bottom where it says measurements and you click on here. Here you have your default settings. I usually just keep these if we're just kind of monitoring somebody. But if you have somebody that's in got like a tachycardia or a bradycardia, your lower high limit might be ringing off, like your alarms will start to ring off. So you can change these numbers to kind of reflect your patient's current rate. So sometimes you'll have a patient that's also like in an AFib, and then your monitor is going to keep on beeping and beeping and alarming. You can go to the arrhythmia section, click on this, and you can go scroll down where it says AFib, and you can turn that off. So once you turn it off, it goes to the bottom. And then if you want, obviously, our patient is not in an AFib, so we're going to turn it back on so that we will get an alarm if our patient goes into any kind of an arrhythmia. So at the end of the day too, if your patient has PVCs, those will ring off. If that's a normal thing for them, you can turn that off as well. So we'll exit out of here. All right, you guys, also, see here I'm in lead 1 and V2 lead here. You can change these. If these are not showing up clear, you can click on the V1 lead and you can change your primary lead to all these different leads. If you want a trick to see what the leads look like before you choose, you can go back to Manage Patient and click on Patient Window and click on ECG Analysis. On this screen, you're also going to be able to see all of the leads. So if you were worried about your patient and you wanted to see the reciprocal leads to see if they're same or different, you can go to this screen. This is not like a 12 lead, but it's going to give you an idea if you're going to want to need a 12 lead. So here you can see that V1 is pretty clear. They're all pretty clear. You can kind of just pick and choose what you want. V2 is my second lead. So that's how you would change it. You can just go to the side here and you can change your leads over here as well. So here I have V1 and here I have V2. And then a lot of the time if your patient is kind of beeping off, but it is their like normal, you can click on relearn arrhythmia to make it stop beeping for you. Okay, so now that we've got our patient all ready to go, our settings are good, we're gonna now analyze our rhythm strip. So we're gonna go to manage patient, we're gonna go to review, general review, and then you're gonna wanna pick up a spot in this section closest to like your time of your shift start. So here I'm just gonna click on 10:08, for example. So I think this looks good, not too much artifact. If you're finding that something has too much artifact, you can move over with these arrows, or you can move faster with these arrows, or you can just kind of stay where you are if you don't have artifact. So now what you're gonna do, you're gonna select calipers at the bottom, and then you're gonna start measuring your strips. So your PR interval, we'll do that first. So PR interval, here, QRS. Yeah, so whenever you're done measuring, you just click on the button that says QRS, and obviously the same thing with PR. Now you're gonna measure your R to R. When you're measuring your R to R, if you wanna see if it's regular or irregular, you can move these arrows over to see if it's regular or irregular. Sometimes you'll have it a little bit off here, but that's honestly just showing a rate change. But you can see that it's quite regular as we go along. See? Then you click here. Then you want your QT interval. That's here, and once you're done your QT interval, you just click QTC and pause. Just click those, and then you're done. Then you want to actually name your interpretation. So in this case, our heart rate's 80, all of our numbers look good, so this is a sinus rhythm. So if you notice anything out of the ordinary, let's say you've got a notched P wave, or you find any kind of ST elevation, or your QT is long, you can write it in here. This you can type stuff in. But in our case, we won't do that today. So then you save, and then you'll see everything over here is saved on your strip. And then you're gonna go ahead to the right-hand corner and you're gonna click print strip. Okay guys, also too, if you're measuring your tele strip, so let's say, I'll just quickly put some numbers in here. You're measuring your PR, QRS, R to R, oops, QT interval, and then here, let's say that this was an abnormal rhythm and you weren't sure what it is. You can still measure all your things and you don't necessarily have to put any of these things in. So you can leave that blank and just, you know, we're not diagnosing the patient anyway. It's just our interpretation. So you can have the numbers in, you can save it, and it'll still save with the numbers on the strips. Okay, so now there are a couple of FYIs. So if your patient is going to go off unit for a test or for a shower, you can go back into manage your patient, and then you're going to click on where it says transport/standby. And here you can click where your patient's going, like for what test, or if they're going off unit or shower bath. You'll click the square in here, press OK, and it'll put them on standby. So another thing is you're going to want to print off your tele strip in the at the beginning of your shift, and you only have to do it Q shift unless your patient goes into an arrhythmia or any of the rate or rhythm changes. So if they convert into an AFib, you're going to want to do another tele strip, and if they were to convert from that AFib back into a sinus rhythm, you're going to want to capture that as well. And obviously, when those things happen, you want to get 12 lead ECGs as well. Let a nurse practitioner or a doctor know and get an order for a 12 lead. Okay, so this is what a tele strip looks like. So this is the strip that you're going to give to the unit clerks, and they are going to scan this strip and put it into Connect Care for you. Also, another thing I'd like for everybody to do is right by up here where it has your information, your rhythm interpretation, just put your initials above. That's it. So now that your patient is discharged, you're going to want to go to Manage Patient, and you go to the side here and click on the pink discharge button. And then the pink discharge button again, And that's it. Your patient is now discharged.